teachers who profess or have been led to believe that they would receive attention on demand. The staff would report directly to the Pupil Services Department and not to any individual school administration. All support staff included in this proposal would be recruited to serve during the 22-23 school year calendar, beginning July 1, 2022, with the signing bonuses of $5,000 per professional. I believe at one point during the discussion of information being sought by the board, we requested numbers of special education students at KCS and KMS so that we could determine whether that staff was needed or not. I would like to suggest that we be open to assigning special education teachers, additional SPED teachers, according to the numbers of the population being served. I remember briefly 1 or 2 months ago that if not Ms. Heges or someone else asked for specific numbers, we were told we were going to get them. We have not. So I would recommend added special education teachers for those 2 elementary schools, depending on whether the population at each school requires that staff. I would recommend 1 psychotherapist be recruited and added to the staff at KIS with the proper training and familiarization with the SEL curriculum so that both things are in tandem and not separately, not implemented separately. I also would recommend 1 certified family therapist for high school students in need of direct support and who do not have staff assigned to them to provide compliance services related to IEPs. This professional would supplement the access to 7 guidance counselors at the high school and 2 nurses already available for KHS students. I suggest that these persons would receive additional exposure to services and delivery of services during the summer months and be compensated for it. I would recommend, because I believe accomplishment and achievement are part of a healthy attitude as a high school student, I would recommend the addition of 2 language ELA coaches, 2 math coaches, and 2 hall monitors to be watching over the disciplinary need that has been reported at the high school. These are ideas or staffing levels and purposes of staffing that I submit to you as an alternative, as a model to addressing the needs of our students at all levels. And I would love to hear this body discuss and add, subtract, massage, any way you want, so that our parents and our community at large understand that we have not just voted for an issue on an agenda, we are committed to addressing the root cause or problem that has been brought to our attention. Thank you, Mr. Chair. I would welcome any comments.
Thank you, Ms. Rivera-Abrams. Comments, questions?
I also have some alternatives, so if you want to discuss Ms. Rivera-Abrams, or you could hear some other ones too. I know that the board is not ready to make any kind of a decision, but you know,
Through the chair, I'd like to hear from Ms. Rivera-Abrams why she thinks this is a better option than the student-based health center. Thank you.
Well, there are a couple of things, Mr. Vians. I'm a strong believer in unifying families rather than dividing them. So I think that at the high school, we need a family therapist that can unify the family with any obvious or potential difficulties that there may be in communication between students at that age. I come from a culture where adolescents are still kept within the family umbrella rather than giving them a message that they are adults and able to make adult level decisions. Sometimes I strongly believe that communication is more important than treatment. So I see that we have the makings, the ingredients for a holistic type approach between the counselors and the nurses and a family therapist to address some of the concerns that have been brought to us. That's just one idea that I did not particularly appreciate in the model that was provided. The other one, of course, was having the access. I fully believe that parents sincerely expect on-demand attention to their child's particular need on a given day. And they do not appreciate the fact that with one therapist, there will have to be rescheduled appointments. So students who may be going through a particular crisis at that time would not be able to be taken care of or counseled on the spot at the time that the student is going through it. So I don't believe that the access issue has been protected as parents expect it to be. And so if you have a large population of students at the high school who have individual education plans, they would, by the nature of their IEP, many of them would be referred to the therapist on demand rather than another student who doesn't have. So that question to me was never answered because I want to protect the access of students and families who are not receiving specialized services through their IEP plans. Those are just a couple of the issues that surfaced in my own mind.
Thank you, Ms. Rivera-Abrams. Any other questions, comments? Yes.
I just want to put out there as just food for thought. I had a telephone conference with somebody today, a very nice person who had somewhat of a spirit of compromise here, okay? Something to think about. As opposed to putting this into the school, we take and we maybe interview other places, Insight, United, whoever, And think about maybe doing it remotely by Zoom. They brought this up to me, and I thought in the spirit of compromise that it would be something that we could think about as an alternative.
Thank you, Mrs. Martin.
Ms. Lannon?
Ms. Landon?
I will start by saying that I don't know that there is any true alternative to what the school-based health center can offer our children for mental health care. I think that there are alternative ways of presentation, implementation, and perhaps operating it, maybe, but I don't think the services offered by an in-house student-based health center for the mental needs of our children can be replaced in the same manner. But I'm open to your ideas. This presentation is the first time that I'm seeing this tonight, all of the ideas being presented. Ms. Rivera, this concerns me because we cannot fill our staffing positions as they are now. We have open psychologist positions, to my understanding. I don't know what our guidance counselor levels are, language. I don't know our teacher positions, but I know we have a lot of positions in the district that are open, and I'm not confident that we would be able to fill all of these positions by the next school year. And also, if we can't fulfill full-term positions, one-year contracts alarm me. Some of the ideas presented, I'm sure, will be great alternatives, but we have 6 pieces of paper in front of us tonight on ideas, so I would hope that we're not in a position to make a motion to vote on anything. And again, I'm not convinced that there is an alternative to what would be offered by Generations in the school-based health center. I'm open to other alternatives, other programs, those conversations, but I am curious to know how we would fill these positions if we posted them.
Well, I would point to the signing bonus that I would propose, because the funding of the non-lapsing account is available to us and does not have a deadline or a window that needs to be complied with. So I would suggest that that signing bonus is just one of the attractions. And in some cases, there are individuals who want to be a part of a pilot and not necessarily commit to long-term employment. So it has everything to do with where we seek these professionals. And we can begin by establishing some kind of communication with EastCon, UConn, QVC, UMass, you name it, whatever, the University of Providence, you name it, people who may be eager to just try out or be a part of, like I said, a pilot program, and motivated by the $5,000 bonus for signing in. And after the program or the effort is evaluated, then we can decide whether we want to expand it or make the positions more permanent. But that was just an initial pitch, for lack of a better word.
Ms. Martin?
I just wanted to say that, Mrs. Land, while I appreciate your outlook, I think you can agree with me that this community has a lot of healing to do. And I think the only way to do that is going to be to try to find some sort of middle ground, some sort of compromise. So I think we should work really hard on that. I know you're a huge proponent for it, and I can appreciate that. But I think we need to find some sort of compromise. So I think we need to talk about some sort of middle ground.
Mr. Veens, go ahead.
Thank you, Chair. I was wondering if we might consider the idea of doing both, approving the student-based health center and implementing this action. I think that, in a sense, it seems to me as though, as a board, we're saying we need to go into the non-lapsing account because there's an emergency. But it feels like that emergency was created by the board not approving the student-based health center. And, so it seems like we're going into action for an emergency that we created ourselves. And if we could approve that student-based health center tonight, we wouldn't have to do that emergency action. Thank you.
I'd like to hear Mr. Angeli's presentation.
Mr. Farron, if I may, before I have a few things I just want to add.
Oh, yes, Ms. Mascara.
Yeah, I just first want to say that I appreciate this is on the agenda for tonight. Like Ms. Martin said, there needs to be something done, and I think every member sitting around the table tonight agrees that there needs to be something done. Obviously, there's disagreement on the avenue to get there, and I understand that, but I think that we all recognize the need, and I appreciate everyone's thoughts about how to get there, and I appreciate the ones who think that there is only one way, and I appreciate that thought process. I just want to add something that I've come across recently. Currently reading a few books about this girl named Rachel Joy Scott, and Rachel Joy Scott was the first student killed at the Columbine High School in 1999. And while I was doing research on Rachel and her life, I came across this program that her family created in honor of Rachel and to tell the story of Rachel. And if you don't know the story of Rachel, I think you should all look into it a little bit. It's very heartwarming, and Rachel impacted many people when she was on this earth. But the program that her family created is called Rachel's Challenge. And the mission is to create safer school communities, to prevent school violence, to prevent self-harm, to prevent bullying, and to prevent suicide. And they do this by sharing love, compassion, and kindness. And it's a very in-depth program that can be implemented K through 12 in different ways. And it includes assemblies and workshops and trainings for staff members. And I have a quick little handout that I'll hand to you guys that overviews some of this. If you would like more information, the website is rachelschallenge.org. I think whatever decision is made regarding this, I think this should be looked at. And I have enough copies for Mr. Angeli and the assistant superintendent, and I think this is a way that we can address many of the issues we're facing, not only mental health, but the bullying that is directed towards that, and some issues that our students are facing. So I'll hand this around to you guys. I have a copy for each, so I encourage you to please look at this, and we can hopefully come back to another meeting and discuss the Rachel's Challenge program. But I really think this is a very good resource for our students that we should look into. Thank you.
Thank you, Mr. Mascara.
Lydia, if you want to just take them past.
Thank you.
Mrs. Lannon.
I would just like to clarify that I too believe that we need to address this issue in multiple ways. I am open to multiple ways. Do not think it is a one-way street to where we have to get there, but I do feel that the benefits of an in-house student-based health center is one of the ways that we need to offer support to our children, in addition to the ways that you have all presented. Other districts have implemented both, and I feel as though we can do that here too. I lost my train of thought. I'm sorry. So, Mr. Angeli.
That's my line.
I will hear you take it for that.
Mr. Angeli.
Thank you. I appreciate the sharing of ideas that we have started this evening. Some of them are part of the list that Dr. Nash and I have been compiling, also through communications with Missy Myers from Generations, right? She was the one of the presenters for the school-based health center that we had proposed for Killingly High School. I agree that this is a complex situation addressing the mental health needs of our students, and the school-based health center would definitely not be the only way that we would be doing it. But I brought that forward as an initiative for the board to consider because I felt then, and I still feel, that it would be an important addition that we could make to the ways in which we facilitate our students working through various issues and crises that they may encounter during their lives. So I'm not off of the school-based health center bandwagon, but I do feel that the ideas that are coming forward tonight, peer counseling, telehealth, bringing in other programs like Rachel's Challenge. I've worked in schools and school districts where that was a component of an overall mental health program. It wasn't, none of these things would be the only thing that we would do, right? We have to have a multiple pronged approach. So the list that we began compiling, and again, if we were to move forward with one or more of these things, then more detail would have to be provided on how to best implement. So they start off very simply, right? We already provide information to students and families about a variety of resources that are available in the community. Those get updated, so we would make sure that the next time that those materials get reviewed and updated, that we are including all of the mental health resources that are available in Killingly and surrounding communities for our students and their families. We could also, if we want to maintain a relationship with Generations, we could distribute information specific to Generations and the programs that they provide for mental health services for students and family members. If we wanted to have a more detailed type of integrated relationship with Generations or another provider, and this is where things become, the devil would be in the details of how we would develop the relationship. So it could be a relationship where Generations at the beginning of the week or at the start of every day, they provide us a list of open appointments that they would have available that day. And then if we had kids experiencing any crises that day, we could try to match them up through direct communications with the parents and Generations to get them slotted into one of those open spots. So that could be one way. It could also start with the school. So the school knows that we have certain students that are experiencing crises or issues in their lives where additional professional counseling services would be important. We would reach out to Generations, and we would try to then facilitate those students getting slotted into appointments that Generations would hold for Killingly students. And then if if we don't get anybody scheduled in, then Generations would go ahead and reschedule those appointments to other clients. With telehealth services, that could be with Generations or it could be with any mental health provider. The issue there was we would need to provide a space where students who already have telehealth services scheduled can hold that telehealth appointment during the school day in a private location that would be somehow monitored by an adult, that we would have some ability to verify that the student had an appointment scheduled for a specific time, and then we could facilitate the the making of that appointment for the student with a telehealth provider. With Generations, those appointments that we might try to facilitate slots in, some of those might be off-campus appointments at a mental health facility that Generations runs. They do not have one in Killingly. The closest one would be Putnam, and so that would be something that either occurs outside of the school day, or a student would have to be released from school to a parent to attend that appointment. Or it could be a telehealth appointment where the student would be able to stay in school, have the telehealth appointment, and then resume the school day. So we have begun that conversation. As Ms. Rivera-Abrams presented this evening, an option would be to determine what additional staff we would need to hire in order to increase our ability to provide services for our students. And then we would need to identify funding sources. Ms. Rivera-Abrams has identified the non-lapsing account. That is something I think that could work short-term, but if we're looking for long-term duration, we would need to stabilize that funding source so that the positions could be maintained. I do appreciate that Ms. Rivera-Abrams not only included mental health professionals in her plan, she also included supports academically. And so I appreciate that. There's always a need for that as well. I would say that I appreciate that Ms. Rivera-Abrams understands that we do have students that are identified for special education, and they will have individual education plans that require certain types of counseling services. But I would not want people to feel that mental health is a special education issue, because it's not. Mental health is something that we really need to be cognizant of and support all of our students, whether they are receiving special education services or they are a part of the general ed population. So we should not conflate the two. They are special ed and mental health are not the same thing, okay? So I just don't want people to feel like we're only going to take care of the needs of a certain population. We would like to provide supports for all of our students. And then lastly, what we've discussed with Generations, because there was a concern raised during the discussion at the March 16th meeting that a 5-year duration for the agreement seemed a little long. Despite the fact that the language in the agreement said the duration could be changed at any time, if the board wanted to engage in an agreement that was automatically a shorter duration, if you wanted to do a 1-year pilot, a 2-year pilot, Generations would be open to that. We have to understand that the way we are originally going to roll out the school-based health center was a little bit of a pilot already, right? So services were going to be provided for 2 or 3 days a week, and if the student need was there, we would increase services all the way through 5 days a week. Our program was based on it would be somewhat self-sustaining, meaning that we were not looking for any type of grant funding in order to maintain the school-based health center. We would, if there was revenue through billing for services that, would sustain the program, then we would be able to maintain it. If we were not able to maintain it that way, then either services would be reduced to a smaller number of days, or we may have to look for grant funding to offset costs. But the initial rollout was going to be a self-sustaining school-based health center that would be sustained through billing for students who were receiving services. So it was not grant funded, and it would not cost the board any money. So, one thing I would ask the board to consider, while Mr. Vian said, hey, why don't we do it all? I'm all for that too, but I also understand there's limitations. But if it would be more palatable for the board to have a shorter duration kind of pilot program for the length of a school year, and then we revisit, we get some data on how many students are using the services, et cetera, and we report out to the board so that we could continue perhaps into a future year, I would ask the board to consider that as well.
Thank you, Mr. Angeli. Mrs. Martin?
Thank you for that. I just wanted to say that Mr. Mascara did a lot of research on Rachel's Challenge, and it's a really amazing program. It's really amazing if everybody wants to look into it. And I also wanted to say that while I voted yes for the mental health clinic, I never want to be that person that says it's my way or the highway. I think that some sort of compromise is imminent, and we should all think about coming together and figuring out how we can do that. It can't be my way or the highway. Even though I voted yes, I still don't believe that that's the way things should go down. We should all come together and try to figure out the best solution for the children and for the parents and for the community.
Thank you. Any other comments or questions? Yes, Mr. Veens?
I would just like to go on the record of saying I think we should do the student-based health center first. And I think that it's right there for us. And I was wondering if I could take the temperature to see if people would be interested in doing it for 1 year as a trial. Thank you.
Yes, Mrs. Lehnen?
I would also like to support the idea of the school-based health center. I mentioned at the discussion at the high school that we don't have a long-term contract with them. That's not a need. We can reduce that contract. My thought that I lost earlier was, in fact, to reduce the contract from a 5-year contract to a lower contract, so I'm happy that you brought that up. And another thing that parents and community members have expressed concerns about that I've heard is parental consent. We, I believe, would have the option, and I understand in other school districts, parental consent for in-house mental health care is required at the start. And you can also opt in or opt out to care in the facility, as you can opt in or opt out to receiving guidance counselor care within the schools. My proposed alternative would be to reduce the time period from 5 years to a more comfortable period where we can see if it's working, and have an open conversation with generations that if they begin to do things or act in a way that is not to our ethical standards or become questionable, we can have a rediscussion at that time, if and when that happens, but I don't anticipate that it would. I think that this is a free, readily accessible resource that we can give our students now, and while these ideas are fantastic, there's something that we can implement, albeit short-term, as a pilot now while we continue to discuss these ideas going into the upcoming school year. So that would be my proposal, along with, I guess I agree with Mr. Vance.
Thank you, Mrs. Lehnen. I just had a question on some of the things you just said. I think I missed a little part of it when you're talking about the opt-out for parental consent or the opt-in. So are you saying that as a school, we would have the ability to not allow no parental consent before counseling, or is that?
No, I'm saying the opposite. I think, if I understand what you're saying. As a parent, I support personally that my child could go to the student-based health center at her need, at her leisure, if she decides to. There are parents who don't agree with that parental mindset, and I'm fully respectful of that. So those parents have the opportunity to opt out and say, my child cannot participate in this program at all.
Thank you.
If that's their choice.
Yes.
I'm not sure if they can do that because of the way the legislation is presented, but we'd have to look into that. I mean, these are all good options. I just think it's unfortunate that this discussion didn't happen a year ago instead of the one thing that we were presented with that we couldn't really wrap ourselves around, and we were kind of backed into the corner, I felt. So I look forward to looking at these other alternatives.
Thank you. I just had a couple of thoughts on this whole thing. First of all, I like the idea of a 1-year pilot program instead of the 5-year commitment. I'm not really keen on heavy expenditure alternatives to the program. I understand that we could use not free money but non-budgeted money to cover it at the beginning, but I have concerns about that, and I also agree with some of the comments about we're already short on staff and we have recruiting issues in those particular areas. So I don't know if that's a viable alternative. This Rachel's Challenge looks extremely promising. And of course, these are just my opinions. It's not, my opinions are my opinions. I do like the idea of this. I'm hopeful that this is a low-cost program and not something extremely budget-heavy. And if parents are able to opt out of their child being counseled without their consent or knowledge, that's very appealing to me. That was one of my personal main objections to the whole thing. And so I think, we all have research to do at this point and some thinking to do, and I appreciate everyone's comments and things that were brought forth. If there's anybody else like to comment or have a question for anybody at this point. Okay, well, I guess we'll wrap this up. There's no motion to be made on this. Oh, Mr. Beans.
I would make a motion to approve the student-based health center for 1 year. I think it would be something that we could do right now that would be beneficial to our students, and we have the need. Thank you.
I'll second that motion.
Point of order, I think we need to have that be put on the agenda because it only says discussion, it doesn't say motion. It says discussion of alternatives. So I think we would have to have it a motion for it to go on the agenda, like the other things that weren't on it.
I believe that Mrs. Hedges is correct on that.
Okay, I'll make a motion to add the item for discussion of the student-based health center to the agenda.
Yeah, I'd also just like to state that would also require 2/3 vote of the board as an added agenda item.
I just was under the impression that we were discussing alternatives and compromises, so I thought it might be okay to add it. Thank you.
Would you please clarify the motions for the record?
To clarify, the motion that Mr. Veens made was to add an agenda item of voting on
For the student-based health center,
right as a 1-year pilot program.
as a 1-year pilot program.
Mr. Farron,
Yes, Mr.
if I
Mascara.
just may, I'm not opposed to having that discussion. There is a lot of, there's some other alternatives, and again, I understand some people don't believe it's an alternative, and I respect that, but there was a lot of things thrown out there tonight, and I don't think we should rush into making a vote tonight, because we may end up making that decision, but I think we need time to think this over a little bit and everything we've heard tonight before making a decision tonight.
Just that we've had this item for 3 weeks. The superintendent was nice enough to give us a full report that we've all had plenty of time.
Mr. Veens, I'm not speaking of this one specific thing. I'm talking, there was a lot of other things mentioned tonight.
I'm just
Mr.
thinking that
Rivera's
this is an
proposal.
actionable item tonight that we could take up.
Sorry.
Yes, Mrs. Thompson.
I'm trying. So Mr. Vians made the motion to add to the agenda a vote on the school-based health clinic for a one-year contract. Was there a second to that motion?
Yes, Mrs. Landon seconded. And just to continue that discussion, I'm not comfortable voting on that motion right now because I would like an answer to what Mrs. Landon brought up. Can parents opt out of not being notified? Can they opt out to have their child counseled by essentially a stranger without their consent? Can that be bypassed? Can they opt out for their child? You know, if I had the answer to that, that would guide my vote significantly. Just to get that on the record.
So I would have to get some clarification on that. I have spoken with the executive director for the Connecticut Association of School-Based Health Centers, Ms. Melanie Wild Lane. And I believe she said that there is an option for that. She actually testified at the State Board of Education meeting recently where she said that the parents sign a consent form. And so that makes me believe that that is an option.
Thank you,
Right, so
Mr.
she testified before the State Board of Ed that the parents would need to sign off a consent form.
Mr. Angeli, I meant Mr. Farron.
Yes.
I would like a definitive answer. That to me isn't a definitive answer because it is my understanding that state law allows minors to receive mental health care without parental consent. In my eyes, that would override any consent form unless it's written in the state legislature, which I don't believe it is. So, again, I'd be willing to have this discussion, but without those answers, because I agree with Mr. Farron, I think that's a big part of this discussion. I'm not comfortable voting for or against that tonight because that answer hasn't been answered.
Could we compromise and adjust this motion to add it to the agenda for the next meeting? And in the meantime, we would task Mr. Angeli with getting a definitive answer on that extremely important point.
If that would make everyone comfortable with approving the motion, I'm in favor of that. Thank you.
All right, thank you. Oh, yes, Ms. Rivera Abrams.
Thank you, Mr. Chair. During the time I've heard discussion on this issue, I've heard at least 4 or 5 potential alternatives offered, including from the superintendent. That was the idea, to create discussion and potential compromise on how to address this issue. At no time have we seen an agenda item that says potential vote or revisiting the proposal that was brought to us 2 months ago, or amending it or altering it. I just feel that we may be rushing into something without doing any research or sharing of information. I would appreciate the superintendent's office with the cooperation or collaboration of the assistant superintendent to look at all of these alternatives that have been proposed and maybe give us a pro or con or all of these things, all of these analysis of all of the alternatives that have been offered here tonight. just getting the conversation started. Starting the conversation and embracing compromise doesn't mean we're ready to vote one way or the other. You may have had one reason for voting the way you did. I may have another. Other people have another. Have all of those concerns been addressed in the last half hour? I don't think so. But I think the superintendent is in a position to gather all of these options and, together with pupil services and the assistant superintendent, present us with the pros, cons, or viability of alternatives and how we can mix and match. There is no cookie cutter proposal here in front of us. And I think the idea requires a little bit more discussion, if that's the right word.
I don't disagree, Ms. Rivera Abrams, and I think we are at the point, well, I'll let Mr. Veen speak to that.
I would just like to point out, through the chair to Ms. Rivera Abrams, that this is an item that we could, the Student-Based Health Center is an item we could take action on tonight. We know what it can do, and we know the benefits of it, and we've had it before us for 3 weeks. And I feel like if we want to look at the other options down the road, we can, but I feel like this is the option that we should take tonight. Thank you.
Yes, Ms. Rivera.
In response to Mr. Vien's, we already voted on that. That proposal, as it was presented for us and as we discussed it for 2 months or more, has already been voted on. The amendment that you are proposing is still based on the same proposal, except it's for 1 year instead of 5. That's not the extent of the discussion or the consideration of the other proposals that have been presented here tonight.
Yeah, Mr. Veens?
I just think that it would be in the spirit of compromise to approve it. It's just as simple as that, you know.
What's a compromise when you, it's what we all,
This
we've
is
already
something that we
discussed
can
for 2
do,
months.
this is something that we could bring forward right now, and then we can look at the other options further on down the road, because we have a,
That's not
because we have a
compromise.
crisis at this moment in time.
That's not compromise, Mr. Vince.
Um,
It's my way or the highway.
Could I
That's
just,
what
could
you're
I-
saying.
could I just interject for a second? I think.
I'm sorry you feel that way.
I think, you know, the concerns that we have about the point that Mrs. Lannon brought up, not concerns, but I think encouragement, if that turns out to be a correct, and I know she didn't make that claim. She clarified that she wasn't saying that, but Mr. Angeli brought up the point that he thinks that it would be a possibility that we could have families opt out of this counseling. That would remove, you know, in for some of us, I don't know, I can't speak for everybody on this board, but that would remove a large issue that I have with this whole thing. So that's why I suggested that we move this vote to next week after getting all the information that we need to properly vote on this. I mean, why do we need to vote on it now? It could fail, and then it could pass next week if we had the, you know, possibly if we had all the information that we needed. Yeah, Mr. Veens?
I'm just waiting for, I guess I'll move the question. We can vote as to whether or not to add the item to the agenda.
To vote tonight or to vote next meeting on the 27th?
To vote to add the student-based health center. I don't think we voted yet to add the item to the agenda.
Mr.
We
F-
said,
not
we-
to interrupt, I'm sorry. Do we,
Mr. Mascara?
clarification.
I believe you have the ability to withdraw that motion. If we are in agreement that we can wait until the next meeting to get that information, I don't believe we have to vote on it. I believe you can withdraw that motion.
I would just like to know how many people are in favor of adding and how many people are not. So I would like to have it carried through.
Okay.
Is that the two-thirds vote you were talking about?
You need a 2/3 vote to add an agenda item that is not on the agenda.
Instead of the 3 members, the way we've been doing it?
Right, when an item is not published to the public on the agenda, and you're adding an you're adding an agenda item to the agenda, it requires a 2/3 vote of the board.
When you're adding it at the meeting?
Correct. Mrs. Thompson?
So are you rescinding your amended motion to move it to the next meeting and charge the superintendent with a definitive answer regarding parental ability to opt out services so that we can vote to add it to the agenda?
Well, first we have to address Mr. Bean's motion. He can have it remain, or he can
So you haven't
rescind it.
officially made the amendment yet?
I haven't officially made the amendment yet.
Thank you.
We're still concentrating on Mr. Bean's motion, and and waiting on his decision if he wants to go forward with that or to rescind it for the time being.
I would like to go forward just so that we could have an idea of who, based upon the new discussion, who's in favor of it. Thank you.
Okay.
I just want to clarify that. It's not necessarily who's in favor for it. I'm open to having that discussion. I'm not in favor of voting on that tonight without all the information. So,
I guess for clarification, I'd like to know who would still like to discuss the student-based health sector.
well, that's not, I
That's
think
not
we all are saying that we're all willing to have a discussion, just not tonight. So the vote tonight, if I vote no, I'm sure we're going to try using it, meaning to make it look like I'm not willing to have that discussion, but I'm telling you right now, on record, I'm willing to have that discussion.
I just feel consciously, as the crisis.
Point of order, move the question, you have to vote right away, no more discussion.
I would just like to say that I am not,
Follow Robert's rules.
I'm not going to rescind the motion. I feel like we have a crisis, and the board should be addressing that crisis moving forward. We should, we've had the information in front of us, and we should address that crisis, and I'd like to know who's in favor of addressing that.
I'd like to
Thank you.
address the outburst from the audience. If that happens one more time, you're going to be ejected from this room.
Well, before we vote, I'd just like to say, Mr. Vians, I think you're playing this very politically by making it seem like we're all against the school-based health center since we're not voting
Through
on
the
it.
chair.
I'm not
Through the
finished
chair.
speaking.
Sure.
But, yeah, like I said, I am willing to have this discussion next meeting when I get clarification from Mr. Angeli on whether or not parents can opt out. So I'm willing to have that discussion, and I may possibly even vote in favor of it. I don't know yet, but I need that information first. And I do not have that information tonight, so I cannot make an educated decision on that tonight. I understand we have all the other information that's been presented over the past few weeks, and I understand that. But the issue that Ms. Landon brought up that could possibly be true, we don't know if it's true or not. So without knowing that information, I can't make a decision. I don't know if other board members are able to make that decision. So trying to say that you want to know if we're in favor of it or not, that's not the question. The question is, I'm not in favor of voting on it tonight without all the information, Mr. Vians.
Well, I would like to just know who it is that I have to, who it is that I would have to talk to try to get them to be in favor of the motion.
Mrs. Hedges?
And I feel like as far as it being a political thing, I think that we have an issue with that. It's a crisis that we need to manage, and we've had the data presented to us, the number of students that would benefit from this health center, and I just think that if we could pass it tonight, we could move forward and we could work on some of these other items. Thank you.
Mrs. Hedges?
I think that in a minute we should move to vote on the motion thing, but I just wanted to clarify that there are questions that were presented that are not answered yet that we've been trying to get answers to, and we don't have a change in a contract in front of us to actually approve. So again, I'm not against that discussion either. However, without all the information, you need to know what my vote is going to be, because I am not voting with all the information.
Mrs. Lehner?
For transparency and accountability, Mr. Angeli, where are we in the discussion that we received notification, as I'm sure many are aware, the board is under investigation by the State Board of Education regarding our decision on this matter last meeting. And recently it's been petitioned that we would have a public hearing to discuss why people who voted no voted no. Will we be required to have a public hearing? And I've heard time and time again that there are questions people have that have not been answered. Perhaps we can have a deadline of what those questions are and get answers to them, because I keep hearing that there's questions, but I don't know what the questions are, other than the opt-in issue, which I've tried to answer for you tonight. So my question for you, Mr. Angeli, is are we required to have a public hearing based on the petition that was based to the town hall? And if so, would we be able to perhaps have another special meeting if we get the answer between now and 2 weeks from now, our regularly scheduled board meeting, to have this discussion if in fact we do find out the opt-in, opt-out answer? Is there a compromise in that regard? And again, the school-based health center isn't the only answer we need. These things are needed too, but they're not readily accessible now. These are all presentations that would need discussion and approval for next school year. The school-based health center is something that we can give to our students who are asking for it and need it now. Thank you.
So a petition was received in the town clerk's office requesting a hearing regarding the board's vote on the school-based health center. My understanding is that the town clerk is still working on verifying signatures. So I don't know the answer to the question of whether or not we will be required to have that hearing yet. So, and regarding questions that were raised by board members, identifying concerns over the school-based health center, one was definitely the issue around parental consent and knowledge. And so, you know, that the whole opt-out, the parent opt-out, I would have to look into. Usually it's an opt-in versus an opt-out. So there is a consent for services. And so I would have to just get that verified. And then the other concern that was raised that I'm trying to address with a shorter duration pilot was a concern was raised around a 5-year commitment through the agreement. And so we can do a shorter one. Beyond those two issues, it's unclear to me what other specific questions may exist on the part of the board. So I don't know what other answers board members may be waiting on.
Mrs. Hedges?
May I just clarify, not only were the board members, I believe, I'm speaking for people that it probably shouldn't be, but I think their actual question was not only about a consent form, but state law overriding that consent form, I believe was the actual question before you to.
When I said
answer.
the
Okay.
opt-out versus a consent form, I do understand that I would need to marry that up with law. Yeah.
And I'd like to add to that. So I don't know if the public knows this or not, but state law was recently changed this past August. So it used to be 6 visits without parental notification. It's now indefinite. So your child could be indefinitely counseled by somebody. Not only will you not get to approve how they're being counseled, what they're being counseled about, you won't even know that they're being counseled. So that's my personal biggest issue with this whole thing, because I think, I don't know if there's some people in the audience that have attended meetings, have seen meetings that are hard of hearing, but I think I've expressed that on more than one occasion, and we keep getting told that we don't have any objections, we haven't come up with any reasons, we haven't said anything, we're just making some kind of political decision. And I'd just like on the record that I've been pretty clear with my objections, that being my main one. Mr. Veens?
I just think that the major reason for not having the notification initially is to allow the student a chance to come forward and express their feelings. And I think that if we could understand that, we could move forward in a way. Having said that, I'll move the question.
So you want, I'm not following.
I would
You
like.
want the vote?
I would like the vote.
Okay, Mrs.
Thank you.
Thompson, would you do a roll call vote, please?
Point of order.
Yes, Mrs. Lana?
What are we voting? What is the actual
On
vote?
Mr. Veens' motion that you seconded to add an agenda item, voting for a one-year contract with Generations on the school-based health center. Is that correct, Mr. Veens?
For the discussion of that, yes.
So that's not clear to me. If we vote on this and it's a no, we then table it again until we make a motion to add it? I don't know what happens next. I don't know, what is the purpose
If
of
we
this vote?
vote no, then it wouldn't get on the agenda.
Tonight.
Then the item would not get on the agenda tonight.
Is it,
And again, I'd just like to state that if my questions get answered and there's, in a satisfactory manner in the answer that I think that people that object to this want to hear, that is going to greatly influence my position on this issue. And we don't have that information right now, but we can vote. It's just a motion to
Mr.
add it to
Farron?
the agenda.
is it to add discussion and a vote to the agenda?
It would be to begin discussing the student-based health center as to vote on it tonight.
Well, it'd be to add,
And
it'd be to add,
usually
we've
if
already
you
had
move the
discussion,
question,
that's on the agenda.
usually if everyone's spoken, Robert's Rules of Order, we move the question and then we have the vote. We don't
Right, so-
we don't continue discussion. That would just put it up for the vote, and then we could
Just clarify.
we could do a roll call vote to add the item to the agenda.
For discussion.
For actually a vote, we've already had a discussion, correct?
Mr. Veens, you're looking for a discussion and possible action on a school-based health center for a one-year contract, am I correct?
I think yes, I am. For tonight, that is correct, yes.
Sorry, Mrs. Thompson. Do you have any further questions before we even proceed, so you can get caught up with?
So the
Dr. Nichols?
motion is to add an agenda item for discussion and possible action for the school-based health center for a one-year contract? To tonight's agenda. May I have 2 seconds to type that in?
Yes. All the time you need.
I'm so confused.
Now you would like a roll call vote?
I would, please.
Mr. Naparata,
No.
Ms. Hedges,
No.
Mr. Mascara,
No.
Ms. Rivera Abrams,
No.
Ms. Lannon,
Yes.
Ms. Martin,
No.
Mr. Vians,
Yes.
Mr. Farron.
No. Okay,
Motion-
motion fails by a vote of 6-2, I believe.
There are 8 of you, so 6-2.
Do we need an official
You
motion?
have 8 people at the table, so the vote fails 2-6.
Through the,
So we'll move, yes, Mr.
I would
Veens?
like to make a motion to add the student-based health center discussion to our next Board of Education meeting.
I second that.
Just, point of order, I can email you tonight. I know it takes, we could either do that or 3 members request it and it'll be put on the next meeting's agenda. I would join you, Mr. Vians, in requesting that we have a discussion and possible action for the next meeting if we have those answers. So I don't know if you would like, you want to vote on it this way, or I'm telling you I will send an email tonight with you.
I just think it's easier to just add the item right now, and I'm sure that Mr. Angeli can come up with the answer to the
So
question.
I will say, based
before
upon
next meeting.
the conversation that the board has been having, we already have more than 3 people who wanted this to be an agenda item for the next board meeting. So I already have a note to add it to the agenda for next meeting. I think we have sufficient cause to do that.
And I fully support that, so, no motion required. 3 board members or more request an agenda item, and it's on the agenda for, as long as it's posted 24 hours at a minimum before the next meeting.
So it's the same agenda item as listed on tonight's agenda?
With the exception that there would be an action, possible possible,
Would be added to that.
correct.
And just for clarification, the student-based health center would be one of those options?
Absolutely. Oh, I'm sorry, Mr. Angeli.
Yeah, so you just confused me with that little piece. So the conversation, I thought, was around adding to the next meeting's agenda a discussion and possible action on having a school-based health center at Killingly High School on a 1-year pilot basis. Right, just the one option, not also to vote on any of the other ones that were discussed in a cursory manner this evening.
So,
Mr. Not to interrupt, I'd just like to make sure that the information we asked for is provided next meeting in order for us to make an educated decision.
I will have it.
Thank you.
that was my question. All of these alternatives that have been presented will not even be addressed?
Well, can I just say something on that?
Please.
I think, they can be addressed, but let's get our main questions answered. Then we can make a decision on that one item, and then we can look at adding additional.
But Mr. Farron, all the questions that you are asking are related only to the generation's proposal. The other ones are not being included in the evaluation, in the analysis, in the comparison.
Would you like to request an agenda item for the next meeting on the other options as a separate agenda item? If we get 2 more members that would like that, Mrs. Hedges would like it, anyone else? All right, Mrs. Martin?
So
So we'll add that as a separate agenda item.
so that would be, that's going to entail a rather lengthy analysis to list all the pros and cons, et cetera, that the board has been asking. We have 1 more workday this week. There is spring break next week. I will be on vacation, as was alluded to earlier in this meeting. I will be back in the office on the Tuesday following spring break. There will not be enough time to do that detailed analysis prior to the next meeting.
I fully understand that, and we don't expect you to come up with some elaborate presentation on those other items by any means. I think just continuing the discussion we had tonight, even if it's without the option of an action or a motion on those, would I think hopefully keep everyone happy. Ms. Rivera, Mrs. Martin.
And I think that we would, in order to make an informed decision on Mr. Vian's motion for the next meeting, we would need the information from you prior
First,
to the next meeting.
exactly.
Well, the information regarding the opt-in or opt-out, that I will definitely have. But the detailed information around all the other items that either I brought forward to the board or Ms. Rivera Abrams or other folks, I'm not going to have enough time to do
Not
an
necessary.
analysis of
Yeah.
all of those things.
Yeah, I don't think
That's what I'm saying.
necessary, correct.
Right, I think everyone understands that. We don't expect you
Well,
to do that.
What's the point then of Rachel's alternative and peer peer counseling alternative, all of those alternatives that have been brought here, not just mine, but the other ones, I believe deserve the same respect and study. So it's if we're going to just have an agenda item added to focus on generations, then I think we're violating the bylaws that require the reconsideration of a vote from the majority who voted against it, not those who voted for it.
Mr. Beans?
If we're making changes to it, then it wouldn't be the same vote. If we're changing the amount of time of the contract, it would not be the
But
same
the
vote.
reconsideration of it
And if we take the
requires
time,
different.
we can certainly look at all the other stuff as well. I think that,
Then
I
we
would certainly
cannot
be
do it for the
willing to
next
look at
meeting.
it. I think we can do the student-based health center for the next meeting.
Mrs. Hedges?
What?
So then we're just bringing the one option again back that's slightly altered.
Well, we're gonna do what the majority of the board wants to do.
Okay.
But in my mind, we were looking at getting the information, answering the question, can parents opt out of counseling if it's a school-based health center? And reducing the term to a one-year pilot program. That, right now, is what was presented through Mr. Veen's motion,
Okay.
or his request to add that to the agenda for the next meeting, that'd be one item, and then we discussed having all the other options discussed as a separate item. Now, if the board is not happy with that, that can certainly be changed. Mrs. Landon?
I'm just clarifying, that's all.
Did you have more to say? Okay. Just as point of clarification and discussion, I appreciate that the school-based health center appears to be something that we want to talk about next time. Typically, if board members want something on the agenda, 3 of us email the chair, and that is how it gets on the agenda. It doesn't necessarily have to be a discussion this in-depth and a vote. 3 of us need to have a concern, and we raise it, we talk about it. These presentations that were put in front of us today are not things that I'm going to scrap or I don't want to learn more about. And I can promise you that I know I already want to know more about Rachel's challenge. I think that we have bullying in our schools, and a program that addresses that would be beautiful. Side note, personally, in addition to a school-based health center. So I'm certain that there are many of us on this board that are going to email and say, I would like further conversation next time about this one, about this presentation, whichever one appealed to us. So I just ask for people to provide a little bit of grace and time for us to present these, to digest and learn about these new programs so that we are in a position to talk about them. And just because we're not saying that we will talk about it next time right now, doesn't mean that we won't. Yes?
Yes,
An
thank you,
agreement?
Mrs.
Okay.
Landon. So yes, Mrs. Martin?
I just want to say that I agree with Mrs. Landon that I see what you're saying, Mr. Veens, but I fear that if you rush this to vote, you're going to get the same result as you already got. So I understand your passion for it, but I fear that you're making a bad decision by trying to rush it to vote because I fear you'll get the same result.
Just in conscience, I have to move I think if
I
people,
understand.
if anyone can understand that, I feel like, we have if you don't do anything in a situation where you should act, and just from a heartfelt position, I feel like we should have acted on this already. And so that's why I'm passionate about it.
I do,
Thank you.
and I understand your passion, and I can appreciate it, but I do agree with Mrs. Landon that we need to consider before we rush to, like I said, get the same result. I would hate for that to happen.
So,
Mr. Chair?
yes, Ms. Rivera.
In the event that my priority in my mind has not been understood by the administration, I continue to ask for assurances of access for on-demand visits to the therapist by making, just tell me how a student is going to receive on-demand services. I've been asking this for 2.5 months. Nobody answers the question. Tell me how a student who is not identified with an IEP having behavioral issues is going to have a priority over a student who doesn't have that. Students who simply are in the mainstream and require that morning that they would like a visit with the therapist. Tell me how you're going to ensure access to that student within the individual education plan of other students. Because the student who has behavioral issues on their IEP already have personnel, staff assigned to them through their IEP. Now, whether that's through psychological services, paraprofessional counseling, whatever, tell me how a student who does not have an IEP get on-demand services from one therapist at a third floor office.
So again, special education and mental health crises are not the same thing, right? You cannot conflate the two. And then I am listening. I would like you to give me time to respond. The students that do have individual education plans are provided resources that we currently have, right, through our own school counseling, through our own school social workers, through speech and language therapists, etc. The counselor that works for the school-based health center is would be a generations employee. We would not have in the IEP counseling services provided by necessarily by an outside counselor. That's a special circumstance. It was explained during the presentation when we had Missy Myers and others here from Generations that students, whether they're special ed or not, who are experiencing crises would be seen because they had an urgent need. So that could mean that a student that has a regularly scheduled appointment might be displaced by a student in crises. That is the same as occurs now with our own staff. When we have a student in crises and they have regularly scheduled appointments with students, our own staff will have to reschedule those appointments in order to address a student that has urgent needs. It would be no different.
Thank you, Mr. Angeli. I think at this point we need to clarify exactly where we're going with this. Okay, so it has to be on the next agenda. The discussion and possible action on the school-based health center, because we have more than 3 board members that want it on the agenda. So that's going on the agenda. Now, the next thing we need to consider is all the other alternatives. And I guess we have support to add that to the agenda as well.
Is
Mrs.
that
Hedges?
something we need to discuss now, or can it just wait for 3 emails from board
We can wait.
members and
We
we
can
can
wait
move the
to see.
agenda along, maybe?
We can absolutely wait.
Okay.
And, honestly, it wouldn't take 3 requests. That's only to make it mandatory. If, somebody makes a proposal, we add something to the agenda. I think in most cases we do that if it makes sense and it was something that had support from the board at the last meeting. Wouldn't you agree with that, Mr. Angeli?
I would.
Okay, so let's, in the interest of moving this along, I think we have, hopefully that's settled. I hope we didn't anger Mrs. Thompson too much. All right, thank you. Appreciate the slack that you cut us at these meetings. I don't know how you do it. Okay, let's move on.